Demonstrate appropriate opportunities to prevent pathogen transmission by appropriate aseptic technique. Describe circumstances appropriate for the use of indwelling urinary catheters. Describe alternatives to indwelling urinary catheters. And demonstrate indwelling catheter maintenance guidelines in order to prevent pathogen transmission. So what is a UTI, or urinary tract infection? Well, urinary tract infections can occur anywhere in the urinary tract, but most often are in the bladder. If that infection is not recognized or treated early or appropriately, the bacteria or the infection can go up the ureters and infect the kidneys. We call that pyelonephritis. And we find that many times the bacteria that is causing the infection is bacteria that we typically have living in our intestines. So when does a UTI become a CAUTI? The following criteria must be met in order for UTI to be considered a CAUTI. The patient has had an indwelling catheter in place for more than 2 consecutive days, with the day of the device placement being day 1, prior to the diagnosis, and the catheter was in place on the day of the event or had been removed the day before diagnosis. The patient has a urine culture of at least 1 bacteria of 100,000 colony-forming units and has at least one of these signs or symptoms: a fever of at least 38 degrees Celsius, suprapubic tenderness, or costovertebral angle tenderness without any other recognized cause.